And now we go into the last session with the question and answer. The first question I think the first question for Norfilza from Bích. Can you please let us know about the sample size of your study?
You are still muted.
You're still muted.
Filza, okay, you have to turn on your microphone. We can't hear you.
Still cannot hear you.
You are still muted. Okay.
All right. Okay.
Oh, now you're muted again. Okay.
Okay. So for the colorectal cancer, we have actually collected 80 samples, 80 samples from various diseases. Of course, mostly from the late onset colorectal cancer. We do have the normal patients that we actually total normal. They're coming just for the screening, and also for the IBD patients, it's actually pre-treatment is actually 25 patients that is actually planned for the vedolizumab, the anti-integrin treatment, and we follow up the patient and see whether they are actually respond and non-respond. Our plan is to actually follow them quite long and see their response to the treatment and see the changes of the gut microbiota in relation to the treatment. That's how we plan to do that.
Okay, yeah, thank you. And also the second question for you, has diet intervention been applied to colorectal cancer patient in your study? And if yes, do you see any different response from individual with a different microbiota composition?
Right. Okay. For the because we test the patients with using the FFQ, and we ask the patient to continue diet as usual. So we did not change the diet at all. So we did not do any dietary intervention. The reason why we want to see whether by just eating as normal, we see if there is a difference in the outcome of the colorectal cancer. Okay, that is the current study, but we have actually done probiotic treatment previously, and we have published this. We follow up the patient colorectal and then remove the cancer, and then we see the patients after post-surgery, and we found that by giving probiotic that contain bifidobacterium and also the lactobacillus, 3 strain each, which is 6 strain. After the surgery, they actually have less complications, recovery really fast, and so on. So actually, the paper is published in BMC Gastroenterology, and we got a very good high citation because of a very good outcome of the probiotic that we use actually, and we still did not interfere with the diet. It's quite hard in Malaysia to do that.
Okay, thank you.
Thank you, Filza. And next question for you, Bích. I was asking the question whether you see similarities between household in terms of the microbiota composition, because usually they eat the same thing, they live within the same environment, regardless of antibiotic exposure.
Yeah, actually, I type in the chat box.
Oh yeah.
Did I?
Yes.
Or question for me, I already answered and typed in the chat box.
Okay.
So do I need to repeat?
No, it's okay. So you haven't done any observation. Yes. Okay.
Yeah.
And also there's I can't see Iarit's question. Iarit asked you something, but it's gone from my chat box. Could you read Iarit questions, please, for you?
I raised question for
Iarit Taipisitikul. You answered that, but I lost his question.
It's possible that antibiotic do not quite affect the gut microbiota in Vietnam because of the antibiotic resistant genes already present in the gut of the general population, enabling gut microbiota to tolerate antibiotic expose.
Okay.
Yeah. Did you see my response?
Yes, I see your response. Thank you.
Okay.
I give it back to you for the next question.
Okay.
Leslie.
Yeah, for Leslie, from Sapirina, she asked about your study related to COVID-19. Did you also consider the influence of COVID-19 vaccination?
Yes, thank you for the question, Safarina. Yes, we did. But I have to say that for this group of participants, most of them are non-vaccinated yet because the recruitment occurred in the first half of 2021 when vaccines or when most of the population were not vaccinated yet. And for the vaccinated participants that we recruited, because this was still early in 2021, they just had one shot of the vaccine and no booster yet. So none of the participants had boosters. Some of them, 10%, around 10%, just had one shot of the vaccine. But yes, we did analyze if there is an effect, but apparently the first shot of the vaccine does not have a significant effect on the gut microbiota if we compare between the severity groups. So the study really did elucidate how COVID-19 of different severity would change the gut microbiome.
Thank you, Leslie. Very clear.
Very clear, yeah. Okay, any question for Leslie?
I think Filza asked some questions in the chat box to Leslie before we go to Sonia. Oh, no, I think it's for Sonia, yeah.
Yeah, for Sonia. For Sonia, the first question also from Safarina, yes. Does different dairy sources, for example, camel versus goat versus cow, influence different bifidobacterium species?
Yes, this is very interesting question, and also this question we're going to answer through our research, but it's the analysis on preliminary stage, so I cannot give you a definite answer. Okay, and can I read the next question because I already read it?
It's from Filza, right? Yeah.
May I know if there is a significant difference of the microbiomes present on the iron prepared in cow hides compared to ones prepared in plastic? And does it affect the gut microbiome of the Mongolian people? There is no evidence that microbiome is changed because of using plastic instead of cow hides. But in terms of taste and texture of the product, we can see there is a difference. So the plastics might have effect on the microbial community. So because there is a lack of experience, I can't say what kind of effect it can have on gut microbiome of Mongolian people.
Thank you. Thank you for Sunny. Any question for our speaker? I saw one message. Oh, no. Okay. So if have no question, we can close this session, and we have a few minutes for break, and then the last session we start at 12, right?
Yes.
Okay, thank you
very much. Thank you all.
Thank you.
Wonderful presentations. Thank you.
Thank you.
Bye-bye.
Bye.